Hello everyone, I'm Catherine from Dr. Mehta's hospital. Now let's see about gastrostomy feeding. Gastrostomy tube is a special tube in child's stomach that will help feed food and medicines. Articles needed for the gastrostomy feeding procedure are extension or feeding set for gastrostomy button, gauze piece or clean cotton cloth, feeding syringe, small syringe for flush. Feeding content, mainly the feed should be in a room temperature and the consistency should be in a semi-liquid form, and a glass of water to flush. We have to follow before starting the procedure are: number 1, food should be ready at room temperature. Number 2, be sure that feeding tubes are sterilized before and after each feeding with the warm water. Next is about caring for the G-tube site. Clean your child's skin around the G-tube 1 to 2 times a day with mild soap and water. Dry the skin well with a clean towel. Do not use any ointments, powders or sprays around the G-tube unless told to do so by your doctor. If any rash or ulcer seen, meet the doctor immediately. Let's see about the position which needs to be maintained while feeding. A child, infant or adult needs to be in an upright position during the entire feeding. An infant or a small child may be held in your arms. A child or adult may be seated in a chair. If the feeding is given during the night or to someone who is in bed, the goal is to keep the head higher than the stomach. Elevate the head and upper body to a 30 to 45 degree angle by using several pillows. Next is about the procedure steps of syringe method with extension tube. Wash your hands with soap and water. Gather the needed articles. Check that food is warm or at room temperature by putting a few drops on your wrist. Prime or flush the extension set with water before connecting to G-tube button. Open the safety cap on the G-tube button. Hold the G-tube button firmly between 2 fingers. Align the black marks on the end of the extension feeding set and the G button. Insert the extension set securely into the button or port marked gastric. Turn no more than a 3/4 turn clockwise to lock. Make sure the feeding set is locked in securely. Remove the plunger, then keep aside and use the feeding syringe. Attach or insert the empty feeding syringe into the open end of the feeding port. Slowly pour the recommended amount of feed or medicines into the syringe. Unclamp the feeding tube and allow the feeding to flow through the tube. The feeding will normally flow in over 15 to 20 minutes depending on the quantity. Lifting the syringe higher will result in a faster flow, and lowering the syringe will result in a slower flow. The syringe may not hold the entire amount of formula, so you may have to fill it several times. When the feeding is finished, pour water into the syringe to flush the tube. For adults, this is routinely 20 ml to 30 ml and 5 ml to 10 ml for younger children. Clamp the tube and remove the syringe. The infant, child or adult should remain sitting upright for 30 minutes after the feeding. It is preferable to keep for better emptying. If you use an extension or feed set for a G button, disconnect it by turning the button or port counterclockwise. Remove the extension set and close the button safety cap. Wash the feeding set with warm, soapy water and let it air dry. Let's see about giving medicines through G button. Try to give your child medicine outside of mealtime. The medicine should be liquid or finely crushed and dissolved in water so that the tube does not get blocked. Always flush the tube with a little water between medicines. This will make sure that all the medicine goes in the stomach and is not left in the feeding tube. Never mix plenty of medicines. After completing the procedure, all of the equipments should be cleaned with hot, soapy water and allow it to air dry. Last but not the least, everyone should know when to call the doctor. When the feeding tube has come out and you do not know how to replace it, then call the doctor immediately. If there is any leakage around the tube or system, and if there is redness, irritation, rash, ulcer on the skin area around the tube, then you can visit the doctor immediately. I hope this video is useful for you. Thank you for watching this video.